This is Jane Doe. She earns $60,000 a year. She's quite content. Little does she know that nearly 20% of that paycheck is going to be spent on health care. You see, Jane lives in the United States, and the United States spends double what other similar countries pay per person on health care, but has worse health outcomes. Declining life expectancy, higher maternal and infant mortality rates, higher rates of medical error. Just last year, the United States spent over $3 trillion on healthcare expenditures.
$3 trillion with a T?
Yep. An ambulance ride to the nearest hospital in America can cost thousands. Jane Doe's trip cost her about $1,300, but her insurance is going to cover $1,050. In essence, Jane Doe, before even stepping foot in a hospital or meeting a doctor, has already racked up a charge of $250. Once admitted, a nurse conducts an electrocardiogram. That costs $400. A doctor orders a few tests to rule out a heart attack. Blood tests cost about $1,000. Blood tests means venipuncture, $20. Urine tests, $83. Chest x-ray, $348. The overall ER admission fee, $2,961. So that's $4,812 for the hospital visit on top of the $250 for the ambulance. Now, the hospital was in network, so her insurance negotiated it all the way down to $3,711. But that's not all. Jane Doe's insurance only covers a portion of the ER doctor's bill, leaving her with another burden of $250. So that's $3,711 for the hospital visit, $250 for the doctor, $250 for the ambulance. That leaves Jane Doe with a grand owed total of $4,211. Luckily, Jane Doe pays $442 a month, over $5,300 a year in healthcare premiums. So her insurance should kick in and lighten the financial load, right? Not quite. Jane Doe has a $4,000 annual deductible with Blue Cross Blue Shield that she hasn't yet met. That means she's responsible for all the medical costs until she has spent $4,000 that year. That means that anything less than $4,000 is hers to handle. In this case, that's all $4,000. In 2017, nearly half of all insured Americans said it was difficult to pay their medical bills before their deductible kicked in.
Why are we like this?
Well, it's mostly because insurance companies, pharmaceutical companies, and the rest of the healthcare industry are able to charge what they want and increase prices at a whim. But what if they weren't allowed to? What if the United States had a program in place that let Americans get the care they need without the crippling debt? What if the U.S. joined the rest of the developed world in offering a tax-based, single-payer healthcare system? What if the U.S. had Medicare for all? An ambulance ride to the nearest hospital in America is $0 at point of service. Doesn't matter where you are or when. You in the U.S., you spend $0 at point of service. Once admitted, a nurse conducts an electrocardiogram, like I mentioned before. That now costs $0. A doctor orders a few tests to rule out a heart attack. Blood tests costs about $0. Blood tests means venipuncture. $0. Urine test, $0. Chest x-ray, $0. The overall ER admission fee, $0.00. The total cost of your visit, all that I just mentioned, including ambulance, copay, and doctor under Medicare for all, is, let me figure it out. Carry that down. $0 at point of service.
What? $0 at point of service? How is that possible?
Well, under single-payer Medicare for All, we will eliminate premiums, deductibles, out-of-network doctors, surprise billing, and all the other horrors of our current system. We're going to replace all of that with a system of progressive taxes that asks the wealthy and large corporations to pay their fair share. At the same time, the government will use its leverage to finally negotiate fair prices for all Americans to bring down the cost of care. This isn't a radical or new idea. We see this in countries all over the world, including our neighbor to the north, which is, Canada.
But won't that mean I'll have to pay more taxes?
Don't let the critics fool you. When you add up all the healthcare costs Americans have to pay, we're already some of the highest taxed people in the world.
What the is this?
Even worse, in America today, the poor pay more of their income towards healthcare than the wealthy. Under single payer Medicare for All will finally distribute that cost fairly.
You're going to be more accessible than ever.
That's why study after study shows that compared to the current system, single-payer Medicare for All will be an effective tax cut for most Americans.
This is right. It can't get no righter.
You'll be paying less and getting more. What could be more American than that? So the real question isn't, how are we going to pay for Medicare for All?
It's how can we afford to pay for our current system?